What is photodynamic therapy? It is a process which involves a sensitizer, and that sensitizer is either derived from the blood or from the chlorophyll of plants, and the new generation of photosensitizers are derived from chlorophyll in plants. And they are far more beneficial than the heme ones because they are not soluble in fat, they are soluble in water, and they are more readily taken up and excreted in the body. They have a place as a Trojan horse for cancer. The cancer sees the chlorophyll, which is green food, as a metabolite for them, a food for them, and they take that up, concentrate it within the cancer cell, and then it waits its turn for metabolism. There's an interval of minimum of 15 hours, and once that time has passed, the sensitizer has left the normal cells and aggregated in the cancer cells, and then shining specific light wave, either derived from LED lights or laser lights of specific wavelengths, shining them on the cancer cell causes pathological photosynthesis within the cancer cell, and that process of oxygen formation destroys the cancer. Photodynamic therapy works by this internal cellular disruption, and that cellular disruption is in 4 different forms. One is it causes necrosis of the cell. The second is and therefore death of the cell. The second is that it affects the small blood vessels of the cancer, and there are agents that have an avidity to those small vessel malignant systems, and with that they disrupt the circulation, and therefore a second form of cancer cell death. And the third thing that happens is that there is an aggregation of the inflammatory cells of the body, that's neutrophils and lymphocytes, into the cancer that's now dying. The lymphocytes are the inflammatory mop-up system, and the lymphocytes have a secondary and very significant role as the immune system. So this disruption of the cancer cell, the invasion of the lymphocytes, stimulates an immune system like as if it's an immunisation program that you may have had as a child. But the immune system then 7 days later makes antibodies to the cancer, which then is known to attack the cancer at other sites further away from the primary disease. The innovations of photodynamic therapy in my laboratories has been to further explore and indeed prove that there are changes which are detectable either in the laboratory or under photographic imaging techniques. And in the latter case, we can show that there is immunofluorescent photography changes of the photodynamic process, which gives us firstly a diagnostic tool and secondly a therapeutic effect tool. So there's 2 advancements: diagnosis and therapy with photodynamic treatments as the first thing, and my second role has been to explore the possible metabolic byproducts of that treatment. And the metabolic byproducts of the treatment are related back to the pathological processes that occur during photosynthesis in the malignant cell, and therefore destruction of the cancer cell. So we've looked at inflammatory cells, we've looked at immune cells, we've looked at changes in neovascular cells, and we've had pre and post-treatment urine specimens collected and analysed, and the results of those are most pleasing to me, surprising secondly, that we've shown statistically significant differences in those studies to show there is a pathological test showing proof of effect. My role in regard to photodynamic therapy is to take it back to the Western world, because it's principally been done in Russia and then in China. And the Western world wants to have clinical trials to test efficacy, safety, all those other things. And so I've completed a phase 1 study showing this medicine, food extract, is safe. There are no side effects for it. It's not concentrated in the skin. It is readily excreted, and it is a near enough painless procedure to have done, repeatable within 3 to 4 weeks. In preparation to coming to Africa, I've done some minor research of the statistics for cancer, and it shows that there is cancer incidence in Africa much the same as the rest of the world, except for the incidence of Kaposi sarcoma. And Kaposi sarcoma is a disease in Africa related to AIDS. And AIDS is going to be an ongoing curse for Africa, and a solution isn't easily found. It means that there are something like 20 million individuals under the age of 20 who are without parents, and there are 5 million under 5 and 10 million under 10 who are now left in the situation where they don't have parents. And if it is that my vision, and it is that my belief that photodynamic therapy will have a place, it is with the AIDS group with Kaposi sarcoma. I have no doubt that it's going to be an exciting ride doing those investigation studies through the ethics system, through the normal processes, but in not too long a period, I'm sure there will be results coming out of Africa.